Hi, my name is Andrea. I'm a family nurse practitioner student that's going to be examining you today. Just going to wash my hands real quick. And can you tell me your name?
My name's Whitney.
Whitney, and when's your birthday, Whitney?
January 20th of 79.
Okay, perfect. And where are you at today?
I'm at Research Medical Clinic.
Okay, all right. And what brings you in?
I just had some pain, tingling, just some bothersome symptoms in my right hand for a while now.
Oh, okay. And how long has that been going on?
You know, it's come on just over time, really been bothering me for the last year, but more significant over the last month.
Okay.
It made me come in the last month, but I mean, I've noticed it for about a year now.
Okay. And when you say more significant, do you mean that your symptoms have just gotten worse?
Mm-hmm.
Okay.
Really over the last month.
Okay.
Although it's kind of always been there for a year, but really bothersome in the last month.
Okay. Can you describe sort of where it's at? Can you point for me?
Yeah, it's really in my right hand. Nothing wrong with my left thumb and index finger. My ring and pinky are never bothered, but it's usually the first two, sometimes the third, but mostly the thumb and index.
Okay, and what about your palm right here? Is that?
Yeah, sometimes the palm of my hand is
Okay.
painful, tingly. Sometimes even my wrist.
Does the pain travel anywhere else? Or just mainly the wrist and the...
No, it doesn't really radiate anywhere. It just stays right here.
Okay. And how would you describe what you're feeling?
Numbness, tingling, especially in my right thumb and index finger. Kind of travels up my wrist and sometimes to the middle of my palm.
Okay.
I've noticed lately what brings me in is really that I can hardly hold on to things for a period of time, like trying to hold my phone to text friends. I drop my phone, or it just really hurts to text.
Okay. All right.
Really in the last month.
And what seems to make your symptoms worse?
Worse, my job, unfortunately. I teach a typing class at the local JUCO, so I'm always typing, like I said, texting my friends, just anything with that fine motor. And
is that worse at night?
Yeah, it is worse at night.
Okay.
The only thing that makes it feel better is when I shake it off.
Oh,
but it's always kind of there. It just feels
this
better
motion,
when I do that. Mm-hmm.
Okay, makes it feel better. Okay.
Yeah, it's always there, but...
And then, did you notice your symptoms before you started your job, or was it more so once you started this new job?
It's really with the new job.
Okay.
Didn't ever have the problem before the new job, and lots of texting and stuff using that hand.
Okay, so that was the main event that led up to that. And then what would you say the severity is of your numbness and tingling right now on that
Right
hand and
now, again, what brought me in is that it's gotten worse lately, probably a 6 out of 10.
Okay.
But, before it got to the point of bringing me in, it was maybe just like a 2 out of 10, but lately it's been like a 6 out of 10.
Yeah, that seems to have gotten worse.
Mm-hmm.
Well, we're going to try to get to the bottom of that. So I'm just going to go over some history. Have you been diagnosed with any medical conditions besides anxiety that I see in your chart?
No, just anxiety. I think that was diagnosed in 2009.
Okay.
But that's controlled with medication.
Okay. So no inflammatory conditions or arthritis or any problems with your nerves in the past?
Nope, just anxiety.
Okay. Any surgical history?
No.
No. And then it's shown here in your chart that your mom and dad, they're 65 years old and they both have hypertension and hyperlipidemia.
Mm-hmm.
Is that correct?
Mm-hmm.
Okay. Any other new conditions with them?
No, just high cholesterol, high blood pressure.
Okay. Any kids?
No children.
Okay. And then we're showing that you're up to date on your immunizations. When was your last flu shot?
I just had it about a month ago.
Okay, perfect. And then when was your last pap smear?
About 6 months ago. It was normal.
Okay, perfect. And then do you take any medications, including over-the-counters or vitamins?
I do take Tylenol PM. It helps me go to sleep. It seems to help with the pain and, helps me go to sleep since it is worse at night.
Okay.
And then I take the one medication for anxiety.
Okay.
I don't know the dosage of that, but...
Okay. Was it Xanax?
Mm-hmm.
Okay. Mm-hmm. Okay. That's what I have in your chart here. And then how often are you taking the Tylenol?
Several nights a week.
Okay.
That's the only thing that I can...
You say like 3 to 4 or 4 to 5 or...
Just like 1 to 2 times.
1 to 2? Okay.
When I really need it to fall asleep because the pain is worse at night.
Okay. And what dose are you taking? Do you know? Or
I have no idea. I just
take it according to the bottle?
Yeah.
Perfect. Okay. All right. And then any allergies to any medications or food?
No.
No?
No allergies.
Okay. Any history of tobacco use?
No, never.
Okay. And then any alcohol or drug use?
Maybe like 1 glass of wine a week.
Okay.
But no drugs.
All right. And then you did mention your job. You're teaching a typing class.
Mm-hmm.
How often would you say you're teaching that class? Is that a full-time job?
Oh, yeah. That's 8 hours a day, 5 days a week.
Geez, that's a lot of typing.
Mm-hmm.
Okay. And do you get any breaks at all, or do you just...
Not really. I'm just constantly typing, no breaks, and unfortunately with social media and communication these days, everybody's emailing and texting on the phone too, so just a lot with my hands lately.
Okay.
I type all day and come home and text all night.
Okay, so that's a lot of use of your... Are you right-handed or left-handed?
Right-handed.
Right-handed, okay.
And that's the one bothering me.
Okay, so no symptoms in your left hand?
No.
Okay. All right. And then, are you single or married?
Not married and haven't been in a relationship for a while.
Okay.
Haven't found the right guy.
I'm sure you will. Do you ingest any caffeine at all?
I do. I could use some right now. But I drink about 2 cups of coffee a day.
Okay.
Plenty of water, but 2 cups of coffee a day.
Okay. All right. And do you get exercise?
Yeah. 30 minutes almost every day, 4 or 5 days a week.
Okay.
I probably skip the weekends running.
Well, that's still pretty good. Do you feel like you eat pretty healthy?
Mm-hmm. Yeah.
What does your diet consist of?
Mostly fruits and veggies, a little protein here and there. I'd say I'm very healthy, just need to keep managing that stress. But overall, I'm doing pretty good.
Okay, perfect. And then do you have any exposure to pets or any travel outside of the country?
Mm-mm.
No.
Nope, I'm pretty much a homebody. Don't really leave Kansas City. All my family's here, so no.
Okay.
No travels.
All right. Well, I'm just going to ask you some more questions, just sort of more specific to the hand problem that you're having.
Sure.
So, have you had any fatigue or recent infection?
No.
No. Any nausea, vomiting?
No.
What about any fevers or weight loss?
No.
No. Okay. And then any rashes or skin changes that you're concerned about?
Mm-mm.
No.
Haven't noticed any.
Okay. Any shortness of breath or wheezing?
Mm-mm.
No. And then what about a cough?
No.
No. Okay. And then any chest pain or palpitations?
No.
No. Okay.
Pretty healthy other than the hand.
Okay. And I know I already asked you some questions about your right wrist and your hand, but have you noticed any swelling or redness at all?
Mm-mm.
No. Okay. And then what about like limited range of motion? You feel like you can't move your hand certain ways?
No, that's
Okay.
all fine. It just kind of numbness, pain, and tingling. I wouldn't say the range of motion is impaired.
And any recent trauma or injury to the hand, like slamming at anything? Or no? Okay. All right. Well, we're just going to check your vital signs real quick. So Whitney's vital signs, her height is 5'7", her weight is 150 pounds, her last menstrual period was 2 weeks ago, Her temperature is 98.6 degrees Fahrenheit. Her heart rate is 92 beats per minute. Her respiratory rate is 18. Her blood pressure is 118/68. Her O2 sat is 99%, and she's already told us that her pain is 6 out of 10, and that's in her right wrist and hand. So I noticed that Whitney's dressed in an appropriate manner for the weather. She answers questions appropriately. She's cooperative and very pleasant. So that's all good. Her skin looks dry and pink, and intact. Her skin is warm. I don't see any areas of concern. So Whitney, I'm just going to take a listen to your lungs here real quick. Take a deep breath for me. So I made sure that I got all the way down to, oops, computer turned off, to Whitney's bra line, because sometimes people don't go far enough down when listening to the lungs. Her lungs sound clear to auscultation. There's no wheezing or crackles. Her respirations are even and non-labored. She doesn't look like she's in any distress. And now I'm just going to take a listen to your heart real quick. Aortic, pulmonic, Erb's point, tricuspid, and mitral. So I heard S1, S2, no murmurs or thrills, and I would listen to her apical pulse and make sure that she has a regular rate and rhythm, which she does. Her heart rate's still 92 beats per minute. So now I'm just going to move on to examining your wrist, because that's why I came in here. So I'm just going to take a look at it. So I'm just going to have you hold your wrist out like that. So I'm looking at her hand, wrist, and fingers on both the dorsal side and the plantar side. Okay. So I don't see any deformities or swelling. And I'm just going to have you relax your hand for me. Okay. So her fingers are slightly flexed when she's relaxed. There's no guarding of that area. And then I'm just going to feel around here. So I'm just going to feel your fingers. Okay. So I don't feel any swelling or tenderness or any bony enlargements of the wrists or fingers. I'm going to feel up here the styloid process. Actually, it's right here. And there's any tenderness there? Mm-mm. No? Okay. And then I'm going to feel her snuff box. And there's no tenderness there. And then I'm just going to have you do some range of motion exercises for me. So, oh, my computer. So if you can just follow as I say, that would be great. Okay, so I'm going to have Whitney flex her fingers towards the floor and then extend.
You want me to do both?
Yeah, you could do both to compare both sides and then go up. Okay, very good. And then I'm going to have you move your hands this way and then out that way. Very good. And then with your fingers, can you make a fist for me? And then extend your fingers, very good. And then with your palms facing down, can you move your fingers out and then back in, out and back in, very good. Okay, and now I'm going to do what's called the Frankenstein's maneuver. So Whitney, I'm just going to do your affected side here. I'm just going to have you make a fist like that, and then can you point down for me like that? Are you having any pain at all? No? Okay. So Whitney would be negative for that test. And then I'm also going to have you stick your thumb out like that. And I'm going to push down on your thumb and see how strong you're. So don't let me push your thumb down. Don't let me. Okay.
Yeah, I can't really.
So there's some weakness in that thumb there. So Whitney would be positive for that test. And then lastly, actually I'm going to do two more. So if you can go like that. And then I'm just going to tap on Whitney's medial nerve 6 times. Are you feeling any numbness or tingling?
Yeah, it's recreating that pain in the palm and tingling.
Okay. So Whitney would be positive for the Tinel's test. And finally, we're going to do the Phelan test. So I'm going to have her press her palms together with her elbows out like this for up to 60 seconds or until she experiences any symptoms. Are you having any numbness or tingling with that test? Yeah.
Yeah. Okay. After about 10-15 seconds, I felt it.
Okay. So that's another positive test for the Phelan's maneuver. So my differential diagnoses are carpal tunnel syndrome, de Quervain's tendinitis, and a ganglion cyst. So my primary diagnosis would be carpal tunnel syndrome. Whitney presents with common symptoms of this condition, including pain, numbness, and tingling of the anterior wrist, the medial palm, and the first 3 digits of the affected hand. She wasn't having any symptoms really in her ring or pinky finger.
The green light's on.
Okay. Whitney also complains of hand weakness, which is another common symptom. Her symptoms are worse at night and relieved by shaking of her hand or flicking, which is also very common. She had a positive Tinel and Phelan's test, which is, again, indicative of carpal tunnel syndrome. So with Whitney, we're not treating, but if I was, we would probably order a nerve test, maybe even an ultrasound, both those just for a more definitive diagnosis. Second diagnosis would be de Quervain's tendinitis, which I would probably rule that out, although she did have symptoms of wrist and hand pain, which can also be in this condition. De Quervain's typically involves pain that's increased with certain motions, and Whitney doesn't have the typical symptoms of swelling or limited range of motion or locking sensation of her thumb. Whitney she could open and close her fist with a smooth thumb motion that didn't reproduce her pain as in de Quervain's would. And she also has a negative Frankenstein's maneuver test, which, if it was positive, would indicate this condition. And then lastly, ganglion cyst I would rule out because with this condition, there's typically a swollen defect or visible signs of a cyst or inflammation. But if I was still suspecting this for some reason, like if she was having swelling, I would just get an x-ray to rule that diagnosis out. But I would definitely say Whitney's probably exhibiting signs of carpal tunnel syndrome. And yeah, so.
All right, thank you.
All right, you're welcome.